I'm Andy Biston of Sussex Healthcare, NHS Trust. The Trust is mainly made up of two sites across Eastbourne and Conquest, but not only are we acute, we also do maternity and community services as well. We support 7,500 staff, over 200 edge switches just in this hospital alone, and then that's repeated in Eastbourne DGH. The size of the network is it's a fair size chunk. Because of the way clinical care is being delivered, it's becoming more and more reliant on IT. There's a new generation of doctors coming through. They're all very IT literate. They're using notepads and tablets at home. They want to be able to use these in the hospital to deliver patient care next to the patient. The Trust Board has really realised that it has to invest in IT. There's no point in putting all these bells and whistles that all the clinicians are relying on to deliver patient care if you haven't put in a rock solid foundation. We've replaced the network and the core that network is delivered on, the fibres that interconnect it all. We put that in because we could provide more of a matrixed core rather than the single point that we had before, that was a single point of failure. This distributes it around 4 points in the hospital, and we can lose any one of those 4 points and the network will still carry on. I would say Conquest has a really solid, reliable base and network to deliver its products on. It's also cost efficient. It's costing us far less to put in than the existing network, but I think the main one is around the more time the system's up, the more time clinicians have got with patients, and we're having to cancel less clinics. We chose Alcatel-Lucent enterprise networks because they could deliver a distributed core network. It has gone seamlessly, and we've cut over the hospital with virtually no downtime, and it was a fairly easy process to swap network manufacturers. One of the things that we're looking for when we choose a supplier is really a partnership, and we've really found that with Kipu and Alcatel-Lucent enterprise networks. They work with you and actually help you deliver the solution. They're not there just to supply the kit. They take the good and the bad and really work through the solution with you. Within the NHS, I don't think there'll ever be more money around, so one of the drivers has always been cost, and that's one of the main reasons why we looked at Alcatel-Lucent. Always look outside the box. Sometimes you get far better value for money, better performance, better systems if you don't go with the run-of-the-mill manufacturers. The network doesn't keep me awake at night anymore. It certainly did before.